with a rare disease can be tough both physically and psychologically, especially for patients who have a bleeding disorder called immune thrombocytopenia, or ITP, when the body's immune system mistakenly attacks a person's healthy blood cells. ITP can cause bruises or tiny red dots to appear on the body, which often cause embarrassment. Other challenges include fatigue and hindered ability to work. People of any gender can have ITP, but it's twice as common in women than men. Here to explain ITP, diagnosis, and treatment is Dr. Altomare. Doctor, tell us more about this rare blood disease and what are the typical symptoms?
Yes, thank you, Debbie, for having me on the program. And it is really my honor to be partnering with Novartis to speak about this rare blood disease. For patients with rare diseases, it's not rare to them. They're living with it for their entire lives. So I think the more information that people have, really the better. ITP, or immune thrombocytopenia, is a disease where it's an autoimmune disease where the body attacks its own platelets. And platelets are the particles in our blood that circulate and help to form a blood clot if we get cut or injured. The lower the platelet count, the greater the risk of bleeding. And so since this is a disease of low platelets, patients have a risk of bleeding. The bleeding can be mild. It can be just nosebleeds or bleeding when you brush your teeth. It can be easy bruising that can happen without warning. And in the most severe cases, it can be serious internal bleeding that also can happen without warning. So you can imagine the burden that patients with this disease live with, worrying about something like that happening at any time.
Doctor, how is this disease diagnosed?
So the diagnosis can be made by symptoms. So we mentioned the easy bruising. Sometimes you can see little red dots on your skin, and what that is actually bleeding in capillaries that burst. So symptoms can give us a clue that this might be happening. Sometimes there are no symptoms at all, and a low platelet count can be picked up on a routine blood test. Now, the routine blood test that I'm talking about is a CBC, or a complete blood count, and this is a standard blood test that most people get anytime blood is taken. So it's not an obscure blood test, it's something that is done often. If a low platelet count is seen, or if there is this bleeding or bruising, many diseases can present that way, or bruising can be absolutely normal. So if any of these things happen, it is important to then go to a specialist and get more of a workup to find out what the exact cause is.
What is the goal of treatment for ITP patients?
So once we make the diagnosis that a patient actually does have ITP, then we are fortunate to have many effective therapies and treatments for this disease. And the goal is to get the platelet count into a safe and healthy range. So if there is active bleeding, we want to treat the active bleeding. If there's a risk of bleeding, we want to eliminate that risk so that patients have less concern that they're going to get into trouble and they can participate in the activities that they want to live a full life. I have a patient who is a school teacher, and when she was diagnosed with ITP, she was worried about doing art projects in her classroom because she thought if she got a paper cut, then it could turn into a terrible bleed and she'd have to go to the hospital. So we were able to start effective therapy, and with her platelets in a better range, she has much less concern and is able to live, a more normal life.
Where can our viewers go for more information?
I like two really excellent websites. One is pdsa.org. That stands for the Platelet Disorder Society of America. They do a wonderful job of describing the disease and linking to other resources, and really have a lot of quality information, and it's a wonderful organization for ITP patients. There is another website called myitplife.com. And that is a very patient-centered website that tells stories of patients living with this disease. And I think that, again, for anyone with any rare blood disorder or just a rare disorder in general, to know that you're not alone and there are other people out there with similar concerns can be really helpful.
Doctor, I'd like to thank you for taking the time this morning to talk with us. Have a great day.
Thank you so much for having me.